Welcome back, everyone. Dr. Dennis Morris is with us today from Lima Memorial Health System. He's the Vice President and Chief Medical Officer. Getting an update on how things are going with the coronavirus. We hear so much about the spread, obviously, nationwide, every part of the country, especially after the Thanksgiving holiday. Give us a sense about how you guys are doing. We hear so much about ICUs filling up and bed space and that kind of thing, but give us a sense what you're seeing there at LMH.
Well, fortunately, we still have, I think, plenty of space, plenty of beds. Staffing still remains a concern. But while we did see a slight drop a couple of weeks ago in our admissions, they're starting to creep back up again. And I think we're seeing that this is a result of Thanksgiving and now the Christmas holidays. And so this is not a time to take off or be overly confident. We've still got to continue with all the safety measures that we've been using.
You bring up a good point because we had so many people travel last week for Christmas and some still returning home, and then New Year's obviously coming up this week and people will be traveling for that. Any words of advice you would give them? Because it seems like as many PSAs as we see in commercials and doctors talking about it, people are still doing their thing and traveling.
Well, I think people have just, unfortunately, feel like they need to get away. It's been a tough 9 months, but we're not out of the woods yet. Obviously, I would encourage people to stay home and not travel. But if they're going to, then when they return, they need to think about self-quarantining. Depending on where they've been, there's some very high rate transmission areas in this country. And so the danger is still there. So I would encourage small family gatherings with the people that you live with in the same house. Social distancing, wearing masks, washing your hands frequently, everything that we've been doing, we need to continue to do.
We did get obviously positive news lately with the vaccine, and you guys got it last week coming in, and your folks getting that vaccine already. Anything you would tell us about the vaccine? We hear so much about it, but the one thing we do know is that it seems very effective.
So far, the data indicates that it is pretty effective. But what we have to remember is that a very small percentage of the population is getting inoculated at this point. So while there is hopefully light at the end of the tunnel, we are a long way from the finish line, and we need to continue with the precautions because right now we're just inoculating some of our first line responders and staff, and we've got a lot of ways to go, and it's going to be several weeks to months before the general public has the vaccine available to them. So this is not the end at this point. It's merely a very beginning of the inoculations.
As you mentioned, it's coming in tiers, and folks down the road the general public will get theirs. We've gotten calls, people asking, what do I do? Who do I check with? Is that one of those things you check with your primary physician first once that is available down the road?
Right, once it becomes available, I think now you can talk to them about it and help get good information, make up your mind whether you want it or not, if you're a candidate for it. There are very few exclusions at this point that we know of that people should not take it. We're encouraging everyone to take the vaccine unless they have a risk of an allergy or something like that. But yes, it's just starting, and there's no sign-up list, no waiting list, nothing like that that's available. But I'm sure there'll be more information in the media once it does become available to the general public.
You guys have been at the forefront for testing, and there's obviously people still out there that would like to get tested, and especially after they traveled. What should they do to get that set up?
Well, you're right. There's still a lot of symptomatic patients. There's going to still be a lot of disease out there. So we would encourage anyone that feels they may have symptoms to call the number that's on the screen. This is a telemedicine visit. You don't have to go in person to be seen. It's a safe and effective way of doing it. And we still offer the drive-through testing 5-6 days a week, and with results in 24 to 48 hours. So that is still available to the public, and that's something that we've been able to provide since early on in the disease when it broke out. And we're very proud of that service that we've offered to the community.
Good information. Dr. Morris, thank you so much for the update. We appreciate it.
Thank you.
Nice talking with you. We'll be back right after this.